You have a diagnosis of osteoarthritis of your shoulder. What's interesting about arthritis of the shoulder compared to other joints is that patients who present to my office with this condition often have way more advanced disease on their x-rays than patients who have hip and knee arthritis, for example. For some reason, our bodies seem to tolerate shoulder arthritis for a longer period of time before it ever becomes symptomatic. In its early phases, we are often very successful by initiating non-surgical treatment. Now, non-surgical treatment could be as simple as just advising you that it's safe to remain active despite having some degree of pain. You're not going to make your arthritis worse. But if the reassurance isn't good enough, there are some symptom-modifying things that I can do to help you with your shoulder arthritis. Sometimes that might include an injection, such as a steroid, or maybe platelet-rich plasma. Alternatively, physical therapy can be an adjunct to any injection therapy. There are times where we can also use oral anti-inflammatories. When physical therapy, injections, and education don't work, and the symptoms are more severe, affecting sleep and activities, sometimes arthroscopic procedures can be done to reduce those symptoms. If that's one of the problems you have and the x-ray evidence of arthritis is not too severe, we can perform an arthroscopy, release the capsule around the shoulder to restore motion, and eliminate debris and delaminating cartilage and things that are floating around the joint that are otherwise irritating it. In our series of patients, that's effective in up to 2/3 of patients for upwards of 5 years. But it's only indicated for minor degrees of arthritis, not severe advanced disease. In a setting where non-operative treatment is ineffective in managing shoulder arthritis, and/or an arthroscopy is not the right solution to give a predictable result, shoulder replacement is an excellent option to potentially eliminate pain and restore normal function. Shoulder replacements have become so minimally invasive that we can actually do them in an ambulatory or outpatient surgery environment. As long as your insurance covers it and your medical status is such that it allows us to do it in an outpatient setting, it's a surgical procedure that takes less than an hour and a half to perform. It is performed through a very small incision in the anterior or front of the shoulder, and post-operatively you can begin immediate range of motion exercises once your block wears off. Now, we use a nerve block to reduce pain. It does require a short amount of general anesthesia, does not require blood transfusion. It allows you early and immediate range of motion beginning on post-operative day 1. I do recommend post-operatively that you use a sling for upwards of about 4 weeks. That's for general protection of the arm to avoid any disruption of the surgical exposure. Physical therapy after a shoulder replacement or after an arthroscopic procedure to treat arthritis usually begins in the first week. It can go on for a matter of weeks or months. Much of it, however, can also be performed at home. Recovery times after shoulder replacement are in the neighborhood of 4 to 6 months total, but you're typically out of the sling and doing household activities within 4 weeks and can drive as soon as you're off narcotics and have good control of your arm. It's important to understand that there are different types of shoulder replacements. If you want to learn more about the specifics of rehabilitation following arthroscopic procedures of the shoulder for arthritis or shoulder replacement, you can go to my website at briancolemd.com.
The best orthopedic care starts with the best orthopedic research. I am a proud faculty member in the Department of Orthopedic Surgery at Rush University, home to the Midwest's largest team of bone and joint scientists. With surgeons and clinicians partnering with elite laboratory researchers and data scientists, we continue to devise new solutions that push the boundaries of what's possible in the treatment of musculoskeletal conditions. Our work informs orthopedic care around the world and is fueled by donors, patients, and families who believe in our research to help more people lead active lives free of pain. To learn more about opportunities to participate in research or become a supporter, please ask a member of my team or visit our website at this address.